Catheter. Following your surgery, you will have a catheter. This will typically remain in place for 7 to 14 days. When your prostate is removed, your urethra, also known as your water pipe, is cut and has to be reattached together again. The catheter is used to protect this area to give it time to heal. Due to this, it is very important that your catheter is not changed or removed by anyone in the community and should only be touched by urology trained staff. If you have any problems, please contact the ward you were discharged from, the surgical assessment unit, or your urology team. The catheter is a long tube that goes into your penis and all the way up into your bladder. It is held in place by a water-filled balloon. It comes out from the tip of the penis and attaches to a bag which will be strapped to your leg. The ward staff will show you how to care for your catheter at home. You will need to empty the leg bag when it is 3/4 full by moving the tap at the bottom of the bag. Hold the bag over the toilet or into a jug to empty. At night, you can connect a larger bag onto the bottom of your daytime bag, which will allow you to get a restful night's sleep without having to worry about monitoring the bag filling. To attach this, you will need to push the night bag connector into the bottom of the leg bag. Open your leg bag tap to allow the urine to flow through, and then rest the night bag next to the bed. We recommend placing it on a stand or inside a large clean bowl or bucket, just to protect your flooring. It is very important that you keep your catheter clean to reduce any risks of infection. To do this, you need to wash your hands before and after touching your catheter. Wash the skin area around where your catheter enters your penis with mild soap and water at least once daily. Ensure you wash away from the catheter rather than washing towards you, as that may cause germs to enter your urethra. Wash under the foreskin if you have one, but make sure you pull it back into place. Do not use any extra products aside from soap and water, as this may cause irritation. Leave the bag in place while showering or bathing. Sometimes the catheter can be uncomfortable. This may be due to the position you have it in, so be sure to use the straps provided. It could also be due to bladder spasms, which are to be expected after this surgery. If this is unbearable, there are tablets we can use to try and help. Otherwise, try to avoid bladder irritants such as caffeine, alcohol, and citrus drinks. It is important to drink adequate volumes to keep your urine nice and diluted, as concentrated urine can also irritate the bladder. Sometimes urine can leak around the catheter during these spasms. This is usually nothing to be concerned about, but if it is large volumes and isn't settling, then please contact us. You may get some leakage around the catheter when you open your bowels, and this can often be blood-stained. Try to ensure you keep your bowel movements soft and avoid excessive straining. If your catheter is not draining, then there are some troubleshooting tips for you to try. The urine in your drainage bag is often blood-stained. A little bit of blood can discolour a whole bag, so there is no need to be alarmed. As crude as it sounds, we typically use the colours of wine to grade the colours of urine. Normal urine is like white wine. A slightly blood-stained urine could be described as rosé and is generally nothing to be concerned about after this surgery, whereas the darker Merlot colour, ongoing, would be concerning, and you should seek our advice in this case. Catheter removal after surgery. Following discharge from the ward, you will be sent an appointment to attend for a trial without catheter, which is often called a TWOC. This is usually done in the urology outpatients by the urology nurse specialist team and involves you being in the department for anywhere between 3 to 5 hours usually. You can bring someone with you to keep you company if you wish. Firstly, we gently remove your catheter by deflating the water-filled balloon and then slowly pulling the catheter out. This can be quite an unusual sensation and can be a little uncomfortable, we try to be as gentle as we can be. You will then have to wait in the department, drinking steadily until you have been able to pass urine at least twice. We will scan you to check your bladder is emptying properly after each time you pee, and if all is well, then you are able to go home catheter free. Ensure you drink well at home in the lead up to your TWOC appointment, as this ensures you are well hydrated and often pee better once the catheter is taken out. Once the catheter is removed, it is very likely that you will have some urinary leakage. Unfortunately, we aren't able to predict how severe the leakage will be and for how long you will have it for. Leakage usually occurs on movement, bending, lifting, coughing, sneezing, generally any activity that puts pressure on your abdominal muscles. We will supply you with some pads to wear initially, and then arrange for a supply of pads to be delivered to you at home. To apply the pads, you will need to remove them from the packet, fold them gently lengthways and secure them into well-fitting underwear. You must therefore wear either jersey boxers or briefs when you attend for your TWOC, and whilst you have to continue wearing a pad. After your catheter is removed, you will need to commence pelvic floor exercises, as ultimately it is these that will help you to gain an acceptable level of bladder control again. There is a separate video regarding these which you can watch. Your flow is likely to be significantly improved once your bladder has settled down following your TWOC. However, this is something you should continue to monitor, as approximately 5% of men will get some narrowing of their urethra at the site of the surgical repair inside where the prostate originally was. This is rectified by having a minor operation to help widen the area again and to stretch out the scarring. The first sign of the narrowing occurring is a decrease in the strength of your flow again. If this occurs, you must let your urology team know, and we will arrange for you to come in for a flow test to see if the operation is needed. Fluids to drink. Certain fluids can cause your bladder to become more irritated. This can lead to more issues with your catheter whilst this is in place and cause urgency, frequency and leakage once your catheter has been removed. Ideally, you should avoid caffeine, alcohol and citrus drinks. Providing you aren't on any fluid restrictions, you should try to consume 6 to 8 average sized drinks per day. This equates to 1.5 to 2 litres of fluid. This is especially important to drink good volumes whilst your catheter is in, and ensure you arrive well hydrated for your catheter removal appointment.